We want to welcome you to Q&A with Doctors A and J, brought to you by Alterman and Johnson Family Chiropractors. Hello, everybody. I'm Dr. Franca Alterman with Alterman and Johnson Family Chiropractors. In today's episode of Q&A with Doctors A and J, we are continuing to bring you what we consider to be some of the most relevant elements of the chiropractic lifestyle to help you gain ideas and strategies to support your health and well-being during this crazy time that we are going through. Our guest today is Dr. Todd Robinson, and Todd is a naturopathic physician in Jacksonville Beach, Florida, and he is going to bring us some really great information that can be helpful to all of us during this epidemic. So Todd, hello. I'm so glad that you're here with us.
I'm happy to be here. Thanks for having me.
Sure. I wanted to ask you if you could please introduce yourself, tell us a little bit about your background, and also explain to people what a naturopathic physician is and what they do.
Oh, I'd be happy to. So I am a naturopathic doctor by training, and I received my training at Bastyr University in Seattle, Washington. Bastyr is one of the, I think at this point it's 6 properly accredited naturopathic medical schools that are spread throughout North America. So by properly accredited, it means that these schools have both programmatic and institutional accreditation from accrediting bodies that are recognized by the U.S. Department of Education or the Canadian equivalent. So these are 4-year graduate level training programs that teach the art and science and practice of naturopathic medicine. And ultimately graduates can then get a license to practice in one of the states that regulates naturopathic medicine, and then oftentimes serve as folks' primary care providers in those states. So I hold a license to practice in Washington state, and in that state I can serve as someone's primary care provider and am sort of integrated into the healthcare system. Florida is a very different circumstance. Florida chooses not to regulate the practice of naturopathic medicine. So here I work in a consultation and educational capacity only, which is still fine. I'm able to help my clients integrate naturopathic medicine into the rest of their healthcare strategy. I just have to work in a different way than I would in Washington.
Right.
So naturopathic medicine is essentially a form of holistic and integrative medicine that really focuses on disease prevention, and we look at the whole person. Our patients are not just their single disease that they're in there for. We're looking at them as real and whole people, and that wholeness is relevant to how you treat disease and how you help someone be healthier and live a healthier lifestyle. So naturopathic doctors receive extensive training in lifestyle medicine. So this is diet and exercise and sleep and stress management and mindfulness strategies and environmental medicine. Also receive extensive training in the use of nutritional supplements and botanical medicines and medicinal mushrooms, as well as homeopathy. There's also training in physical medicine, things like chiropractic style manipulations, adjusting the spine, adjusting joints. So as you can tell from that sort of background, it's definitely a comprehensive and holistic approach to being healthy.
Yeah, absolutely.
Of course, there's training in the use of prescription medications, with special attention being paid to how prescription medications can interact with nutritional supplements or botanical remedies. We make every effort possible to avoid harmful interactions when working with patients. So my background, I graduated, like I said, from Bastyr. I've been here in Jacksonville for 7 years. And in my practice, I consult mostly with folks who have a diagnosis of cancer and are really looking to integrate natural medicine into their overall treatment plan. I'm also a fellow of the American Board of Naturopathic Oncology. To the best of my knowledge, it's the only one that works here in Florida. And so I do take very seriously the service that I provide my clients and helping them live their best and fullest lives, especially in the face of a diagnosis that can be as difficult as cancer.
Yes, well, it's interesting that we are doing this interview with you right now because you mentioned that you're trained in the prevention also of things. And so we wanted to bring you in because we want to get your wisdom about prevention as well as possible treatment or things that we can do before getting sick, and also if we actually get this virus. So let's divide this into the two parts. What can people do preventative? Let's start with that.
Yeah, absolutely. And so to be clear, there are no integrative strategies that have been validated in human trials for this particular virus. So any and all information presented here is based on preclinical work and higher level human data that's been published on other respiratory infections, but it does provide us with a good basis on which to make some evidence-based suggestions about prevention and possibly treatment. And so it is important to note that these suggestions and these strategies are not a replacement for the suggestions and guidelines that are coming from the CDC right now about physical distancing and self-isolation, washing hands effectively and often, cleaning surfaces inside the house that are touched frequently, and getting tested if you suspect you may have picked up the virus. So in that context, let's talk about some of these preventive strategies that you can potentially use. Now, for prevention, I'm a big advocate of lifestyle practices as opposed to supplements or something like that. And the reason for that is, A, they're really effective, and B, they're very, very safe. Anytime you are putting a substance in your body, like a supplement or a botanical, you do run the risk of potential side effects or interacting with other drugs, something like that. So lifestyle practices have this really great benefit of being totally safe. So the first lifestyle practice that I think is worth noting here is kind of a no-brainer, and you're probably expected to come in, and that's to eat a healthy diet. So as much as possible, we want to clean up the dietary pattern, so reduce junk food, processed food, and processed sugars, as those can contribute to increased inflammation and perhaps reduced immune function. But specifically, I would encourage folks to really increase their vegetable and fruit intake. And I would suggest increasing it to a level that's even greater than I would normally suggest for people. And that is in the ballpark of 5 to 7 servings of vegetables per day and 2 to 3 servings of fruit per day.
Wow, yeah.
Some people are like, oh, I can't possibly eat that much food. But the trick is, if you integrate a little bit of that into your breakfast, a little bit of that into your lunch, a little bit of that into your dinner, before you know it, you've hit that 5 servings of vegetables per day. It's once you get the swing of it, it's a little easier than you think it might be. And so other things that you can add into what you're eating are definitely fresh herbs and spices and teas. I particularly like green tea and chamomile tea in this instance. Now, the reason for this increase in fruit and vegetable intake, this increase in herbs and spices, this increase in teas, is because these are all food groups that contain a lot of flavonoids, a class of plant compounds called flavonoids. And flavonoids have been shown to sort of downregulate some of the inflammatory pathways that get upregulated by this particular virus. So SARS-CoV-2 infection increases inflammation in the body in particular ways, and these flavonoids help to sort of dampen those pathways. So you'd expect someone who is eating this really healthy diet, if they do pick up the virus, would be less likely to experience sort of severe manifestation of it.
Yeah, of course.
So the next lifestyle practice that I think is really extremely meaningful for prevention is sleep.
Yeah.
Almost all of my clients, when I first see them at least, report that they are really not getting enough sleep. It's epidemic these days. So sleep has deep roots in regulating the immune system and making our immune system more robust and more functional. So there was one study that compared people who were getting 5 hours or less of sleep per night to people who are getting 7 or more hours per night. And the people who were getting less than 5 hours per night were 350% more likely to catch the common cold than people were getting 7 or more hours. So with the sort of order to stay at home unless you're in essential services, maybe we can all carve out some more time for sleep now. And that, I think, represents a really tremendous possible preventive strategy. And then another lifestyle suggestion would be what we call nature therapy. So this is quite exactly what it sounds like. It's getting out into nature. It's getting exposed to nature. So there's this practice in Japan that gets referred to as forest bathing. That's quite literally the practice of walking through forests in a mindful way. And that's been shown to improve the body's response to stress. It's been shown to upregulate immune function, natural killer cell activity. So while you might not be able to get to a forest, you can potentially work in your garden or start a garden. Even that connection and working with nature is likely to have real meaningful benefit in terms of stress relief and in terms of immune function. And then last but not least, as we're all sort of camping in place where we are, is exercise. So the evidence about exercise reducing the risk of picking up a viral infection is mixed. It's not really that strong. But I think the biggest impact it can have for us now in this circumstance is stress relief. Exercise reduces anxiety. It reduces depression. It reduces distress. It reduces insomnia. And so getting out and getting 30, 45 minutes of exercise, walking, biking, whatever it is to get your heart rate up a little bit, I think can be meaningful, if not from a preventive standpoint for this particular virus, certainly from a mental health standpoint and making this whole process a lot easier for ourselves.
Excellent. I had a question about naps because somebody asked me the other day, if you sleep 6 hours and you take an hour nap, is that equivalent to sleeping 7 hours straight? And I actually was wondering if that's true or not, because then that would qualify it sort of as an interrupted sleep. What are your thoughts about that?
It's interesting. So I don't know that I can claim that 6 hours of sleep at night plus a 1 hour nap in the day would be the equivalent of 7 straight hours. But there is this body of research that's emerging to suggest that human sleep is actually meant to be biphasic. So we have this idea that we're supposed to sleep in this one big chunk, right? Like it's 8 hours or it's 7 hours. And there's research emerging that our more natural pattern may actually be biphasic, where we sleep in 2 chunks, where it's a 3 to 4 hour period. We're sort of lightly awake for a little bit and then sleep for another 3 to 4 hour period. That's based on research where they take people like out away from artificial light, out away from all the things that keep us up at night, and see what sort of circadian rhythm emerges naturally. And it's pretty interesting. Those people report greater energy and greater levels of mental clarity than they ever experienced in their life. And
wow.
It might be because they're getting really good, natural, restorative sleep.
Uh-huh.
So not many of us are able to kind of get out into the middle of nowhere and get away from all that to have that sort of natural circadian rhythm emerge. But I do think the research shows that naps, as long as they're not too long during the day, can definitely be quite healthy and restorative.
Excellent.
So that afternoon siesta may be a good idea.
That's right. All right. So that was a little bit about the preventative side.
Mm-hmm.
Let's talk a little bit about what if you do get either this virus or any other virus. What are some things that can be proactively done to in the natural realm to help if you've already become infected with something?
Yeah, absolutely. So one of the things that I think is really nice is a botanical medicine strategy. So as we talk about some of these natural products, botanical medicines, nutritional supplements, there's one comment to make is that the supply line for these things has been stressed by this experience. And so it's getting harder and harder to find some of these things. So remedies that you can use at home from stuff that you get at the grocery store, I think is going to be particularly useful. So one thing that I like is ginger root decoction. And so a decoction is different than a tea. So you take the ginger root and you slice it or chop it, and then you actually boil it instead. So you have it on active heat for 10 minutes or a little bit more. You let it cool down, you strain it. You can add things like a little bit of cayenne if you like it spicy. I like to add a little bit of honey to it. And that's one of my first go-to home remedies at the first sign of any, particularly respiratory infection. So it is definitely something that I would have on hand right now in case of picking up this particular virus. Some other maybe supplementary strategies that can be helpful, again, based on some of that preliminary research that's been done. And one warning, anytime you want to add a nutritional supplement or a botanical medicine into your current regimen, it's always very important to talk with your healthcare provider, your doctor, your pharmacist, your naturopathic consultant, your chiropractor, about how these things might interact with your current disease state or your current prescription medications.
Right.
Some of these things are a good idea or a bad idea based on some of those finer details. So with that thought in mind, one thing that I'm paying more attention to right now is melatonin. So melatonin is quite familiar to a lot of people for sleep, and it does appear to help decrease the amount of time it takes you to fall asleep at night, if that's the kind of trouble that you're having. But there's some evidence to suggest that melatonin may be useful in the context of COVID-19, in that it can reduce lung inflammation associated with viral infections. And so that's a pretty big and pretty big deal for this particular viral infection. And melatonin secretion and melatonin levels actually decrease naturally with age. And so there are some researchers and some practitioners who are wondering or suspecting if natural decline in melatonin might be at least one of the reasons why COVID-19 seems to hit elderly folks harder than younger people.
Okay.
Melatonin is relatively safe, and so incorporating that into a preventive supplement regimen, I think would be reasonable. Another really nice preventive strategy is going to be zinc. So as is usually the case, the devil's in the details here. There's some really specific information that needs to be known and applied to get zinc to work in this context. So there's evidence to suggest that zinc can interfere with the ability of coronaviruses in general to enter into cells. So in that sense, the presence of zinc would make it a preventive influence. There's also other human level evidence to show that zinc supplementation done appropriately can reduce the risk of developing viral infections in the first place. That effect is much more pronounced in people who are already deficient in zinc. So this would be certainly the elderly, this would be vegetarians, this would be people taking certain medications like stomach acid reducing medications and ACE inhibitors. So zinc might be most effective in sort of that category of people. But the way to use it is as a lozenge. So you want to look for some form of zinc lozenge because you really want to be sort of coating the throat with zinc, and in that way providing some local protection from the virus. And then you want to look for specific forms of it. So in supplements, there's many different kinds of zinc that will be used. And so you want to look for zinc gluconate or zinc acetate. Those seem to be the two forms of zinc that appear to be most effective from an antiviral standpoint. And then another level of complication, you want to try and avoid certain additives. So these things get mixed together to create this like delicious lozenge that you suck on. So you want to see if you can find one that avoids citric acid, tartaric acid, sorbitol, and mannitol, as those ingredients appear to interfere with the antiviral effects of zinc.
Okay.
So it's the type of thing that I would have it on hand, and anytime I go, shopping, I will pop the lozenge and am, still maintaining my physical distance from people at the store, but this is sort of an added level of preventive protection.
Yeah, very nice. Good.
And then last but not least is one that anyone with any passing interest in natural medicine has heard of and is probably using in some way, and that's elderberry, most commonly used as a syrup. There is preclinical evidence to show that it could potentially inhibit the replication and attachment of coronaviruses in general. So that's a general class of viruses, of which this SARS-CoV-2 is an example of a coronavirus. And so there is some, because of that preclinical evidence, we would expect and hope that elderberry might be effective at reducing your risk of developing this particular infection, and is likely to be useful early on in the infection. That's sort of slowing down the rate at which the virus can replicate. So that's all really, really helpful. There is one note that there's some evidence to suggest that elderberry might actually increase one of the cytokines that's responsible for sort of the inflammatory cascade that can happen in COVID-19. And so just to be on the safe side, it's probably a good idea to use elderberry as a preventive, and then just out of an abundance of caution, if you are confirmed to have picked up the virus, to discontinue it so as not to potentially increase that inflammatory pathway.
Okay.
So yeah, those are some preventive suggestions that I know that my family and I are using, and I hope that your audience will find them helpful too.
Well, this is very helpful because, as we all know, if you do get infected, you're not going to end up going to the hospital right away or even to a doctor for this. So these are things that we can all do at home that may just get us through, hopefully without having to end up in the bad scenarios that we have all heard about.
Mm-hmm. And I do think that is, this is a challenging time, but I do think the data is showing us that this infection is mild for the vast majority of confirmed cases. So we're talking 80-81% of confirmed cases really have sort of a mild presentation that if they didn't know any better, they would probably think they just picked up the flu. Now, to be clear on that information, because I know there's been some confusion about this conversation, this virus is definitely more problematic than the seasonal flu. So there's been some comparisons that, it's not a big deal. It's just kind of like a bad seasonal flu.
Right.
And I would say, no, that's not accurate. This is 10, 20 times worse in terms of the case fatality rate than the seasonal flu is. So it is something to take very, very seriously. And I think, your audience will likely be pretty proactive about the things that they're doing to protect themselves and their families. Yes. So it is worth going that extra mile to do some extra steps to protect yourself and your family.
Mm-hmm. Absolutely. I also wanted you to share with that audience if you are available for consultations in case somebody would want to contact you about this, or if you have any other resources or classes that you're going to be teaching online, and where they can find information about this.
Yeah, absolutely. So yes, I'm still consulting with clients. All consultations are being done remotely now, so it's over the phone or via Zoom or Skype or FaceTime. And I am consulting with people who are facing other health challenges during this time, because life goes on for some people. And I'm also consulting with people who are really concerned about SARS-CoV-2 and COVID-19 and would like to be extra especially careful and proactive about reducing their personal risk. And so that is definitely something that I'm doing. Folks can find information about me at www.wellnessworkinggroup.com. That's my website. I've got a contact form, phone number. If you have questions, please reach out. I'd be happy to chat with you. In terms of upcoming classes, there are some things in the works, but nothing on the books just yet. So that information will be posted on my website and Facebook page when it becomes available.
Okay, perfect. We are going to leave also a link for your webpage at the end of the video, so that for those of you who are watching us, the information will be provided in this video. So any last minute recommendations before we say goodbye?
I think that, even though this is a challenging time, this is unique, certainly in my lifetime. It's an opportunity, I think, for us to reevaluate the way we live our day-to-day lives. And I think as challenging as this is, the silver lining is that I think we have an opportunity to maybe move forward individually, as families, and as a culture in a more mindful kind of way, and sort of reevaluate what's really important for us. And so finding the silver lining in challenging times is really important. And I think that's potential silver lining right now.
Something to think about, yes. Okay, very good. So thanks again for doing this. And if you guys have any more questions, feel free to chat with us or to call Dr. Robinson. Have a great afternoon. Bye-bye.